we cannot segregate the religious component into health. What is religious component? In our society, due to religious affiliations, due to various groups uh, quarrel among themselves on the base of religion. So a person to be mentally healthy indicates that he or she should be, religious point of view, that person should be healthy. So then I come to the next point. What is psychiatric illness? Emotional disturbance. We call it as a social deviance and cultural deviance. Is not it? When a person doesn't work properly in the mainstream in his or day-to-day life and deviates from the day-to-day life, then we call it a deviance, and that deviance comes in form of symptom, some psychological emotional symptom that we call psychiatric or emotional illness. So here in our sector, mental health sector, we segregate the illness in two separate pool. One pool is CMD, that is called common mental disorder, and another pool is SMD, that we call severe mental disorder. So in common mental disorder, we put diseases like depression, generalized anxiety disorder, tension, irritation, phobia, and OCD. And OCD means obsessive compulsive disorder and other neurotic spectrum disorders. So then in SMD section, severe mental disorder, there is schizophrenia and epilepsy, dementia, and Alzheimer's disease. Those disorders we call severe mental disorders. So here, due to disease that leads to disorder, due to disorder that leads to disability. Here we as counselors try to eradicate individuals' impairment due to illness, so that after intervention that person works properly in the mainstream of the society. Okay, I come to the point of depression. What is depression? In our society, many people suffer from depression, but those suffering from depression is undiagnosed. From research, it is got that 10 to 20% of person attending PHC, primary health care centers, those are going to primary health care centers for seeking treatment for general physical illness, are found to be suffering from common mental disorders, and the percentage is 10 to 20%. Then how can we know depression? I will come to later about some symptoms of depression. At first, I want to tell you that it is a national emergency. It is a national emergency to treat depression. Why to treat depression? Suppose a person suffering from depression, and when we don't treat depression, at last, due to illness, suppose that person commits suicide, and that person is an engineer, a productive, renowned person of our society, then we lose a labor force, a productive labor force of our country. So it is a national emergency to treat depression. Again, there is a correlation between depression and maternal health. How? When a lady becoming pregnant and of 3 months, and she suffers from depression, what happens if that component of depression, the disease of depression, is not treated? That lady, what happens? That lady consumes less food, feels awkward, and due to that, the child in her womb doesn't grow properly. So finally, the child born will be a malnutrited child. So there is a correlation between maternal health and mental health. So it is an emergency to work on it. But here in our society, mental health is grossly neglected. People think that not that component, mental health, is not coming in our health sector. Side by side, why people think so? That due to the stigma attached to the mental illness. And here we try to destigmatize the illness. Like other physical illnesses, those are like typhoid, malaria, filariasis, cancer, all those illnesses are treatable. So here mental illness is a treatable commodity. So finally we have to treat depression. How can we know that this person is suffering from depression? There are some symptoms of depression, like first you see that there is low mood. That is the first indication of depression. A person suffering from depression will be of low mood. Then appetite, the appetite will be less, and then appetite, libido will be less, then sleep will be less. These are some cardinal symptoms of depression. So then what happens? Then after, when we find these symptoms in an individual, after administering some mental status examination and talking with the individual, then we come to the next component, that will be the treatment modality. What would be the treatment modality for depression? Here we people, as a clinician, as a doctor, we people try to individually talk with the person. That is called individual counseling. We try to counsel the person, to know about him, to know about the family background, to know about the community at large, what are the factors affecting the person to be depressed. So on that particular area we try to intervene, and then after come to the psychological component. What is psychological component? We try some behavior therapy, individual counseling, family involvement. Then after these things, if the person not coming out of that particular situation, we try some other modalities of treatment, that is pharmacotherapy. We call it pharmacotherapy. And pharmacotherapy means we administer some antidepressant drug, hypnotic drugs, mood stabilizers, and that works on the neurotransmitter level of that individual. So he quickly comes out of that situation and works properly in the mainstream of the society. So it is about, I talked about all those things about depression. So here I want to say that we cannot neglect mental health of an individual. So finally I want to tell that no health without mental health. Unless until an individual's mental health is not okay, so then physical health, and that does not mean any relevance. So an individual to be mentally healthy means both physical and mental, both spectrums should be well. So this is the last, and then the next I will discuss about SMD, severe mental illness. Goodbye. Thank you.